we're going to go ahead and get started. There might be a couple of stragglers coming in, but we got a lot of information to cover, so I don't want to keep you here any longer than necessary. So my name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am the State Health Insurance Counseling Coordinator, or the SHIP Program Coordinator. We're going to be talking about everything Medicare. A couple of housekeeping tips before we do get started. We'll go for about an hour. About halfway through, I'll take a survey and see if anybody wants to take a 5-minute break to stretch their legs or get some more refreshment. Anybody who needs to use the facilities, the restrooms are through this door to the side. Men's room is the first right, and ladies' room is the right past the water fountain. What else did I want to say? I think that's all. All right. Hopefully everybody has a black packet in front of them. We're going to be following along with the handouts in the packet with the PowerPoint, as well as referring to some other information in the packet as well. All right, so let's go ahead and get started. This is Medicare 101 or Medicare Who Me, everything you never wanted to know about Medicare. Yes. Let me go grab a couple of pens, please. All right, so through the Area Agency on Aging, the mission of the Area Agency on Aging is to provide coordination and assistance in developing comprehensive systems to allow people to stay in the community for as long as possible. The Area Agency on Aging serves 3 counties here in Colorado: Park, El Paso, and Toler. The State Health Insurance Counseling Program, or SHIP program, is a federally funded program that provides education and advocacy and information about anything and everything Medicare. Our SHIP office provides services to 9 counties in Colorado, and we can help you with anything and everything. We are true consumer advocates. We don't sell any insurance. We don't endorse any specific products or companies. We are here to educate and advocate. Every county and every state should have access to a SHIP counselor in some form or fashion, usually via a toll-free number. Our statewide toll-free number is listed here, and it will give you the office that is closest to wherever you're calling from, and that should be available in every state. So we're going to talk about all parts Medicare, including Medicare Part A for hospitalization, Medicare Part B for all outpatient services, Medicare Part D for drugs. And then you may have also heard the phrase or the term Medicare Part C, which is not actually officially a part of Medicare at this time, but it refers to Medicare Advantage plans. And we're going to talk about all of those as well. But we're going to start with who runs Medicare. Social Security is the entity that determines eligibility for Medicare. As we work, we pay taxes. Some of those taxes get paid into the Medicare and Social Security systems. Social Security keeps track of that and determines how much work history you have to, so that you become eligible for Medicare or entitled to Medicare. They enroll you in Medicare, so you have to contact Social Security to enroll in Medicare, and they issue the Medicare cards. Once they've done that, they don't want nothing to do with Medicare. If you have any questions about Medicare after that, then you would contact CMS or the Centers for Medicare and Medicaid Services, basically Medicare. Medicare is who processes claims. They determine benefits, they pay providers. Medicare is available 24 hours a day, 7 days a week via toll-free number or their website. There is no brick and mortar location for Medicare anywhere. Social Security, on the other hand, has offices regionally, and we do have an office here in Colorado Springs. Who can have Medicare? Basically, as long as you have paid taxes, you have a work history paid into the tax system, and you turn 65, you automatically become eligible for Medicare, simply based on turning 65. However, you can also become eligible for Medicare if you have been determined to be disabled by Social Security and receive at least 24 disability income payments. You will automatically become eligible for Medicare at month 25. If you are diagnosed with ESRD or kidney failure or Lou Gehrig's disease, ALS, you can automatically become eligible at any age within 2 to 4 months. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is eligible to purchase Medicare. So when should you get Medicare? Well, the bottom line is you don't have to be retired in order to enroll in Medicare. On the other hand, you don't have to enroll in Medicare at 65 necessarily. There is an enrollment period that is surrounding your 65th birthday eligibility. That enrollment period is the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That 7-month window is your initial enrollment window to enroll in Medicare without penalty. Any months that you enroll prior to the month of your 65th birthday, your Medicare will become effective the first day of the month of your 65th birthday. If you enroll in any of the 3 months after your 65th birthday, then your Medicare benefits will go into effect 2 to 3 months after your enrollment month. There are other times that you could enroll, some with penalties, some without, and we're going to talk about those as we go. Other enrollment periods are going to be Special Enrollment Period and General Enrollment Period. So this is what the Medicare card used to look like. I still call it the red, white, and blue card. Had your name, had a Social Security number, either yours or someone else's, indicated whether you're male or female, indicated when your Part A and Part B of Medicare benefits went into effect, and you had to sign it. That has changed. It changed at the end of 2018, and now looks like this. It's still red, white, and blue, has your name on it, no longer has Social Security numbers. And of course, that is for your protection. Your ID number is now a random series of letters and numbers. Indicates when your hospital Part A and your medical Part B benefits went into effect, and that is it. No longer require a signature or indicate male or female. Anybody who is entitled or enrolled in Medicare as of the end of 2018 will get this new card. Anybody who had an old card, that card was no good at the end of 2019. So if you didn't get a new card and you try and use the old card, it's not going to work.
Do you have to request the new card, or should they automatically send it to you?
If you had a Medicare card prior to the change or prior to the end of 2019, and you didn't get a new one automatically, you need to contact Social Security or Medicare to request one, because everybody should have gotten one automatically if they were currently on Medicare. Again, Medicare is available 24 hours a day, 7 days a week, 365 or 66 days this year, a year, via their toll-free number or their website. Medicare does strongly encourage people to create an account on the Medicare website, My Medicare account. This is not the same account as the Social Security or My Social Security account. Totally different accounts. The My Medicare account is much, much easier and quicker to set up than the Social Security account may have been for you. There is a handout in your folder that kind of walks you through the process. The benefits of doing that are you are able to look at any claims that have been submitted by providers on your behalf immediately, instead of waiting for the paper summary notices to come in the mail once every quarter. You can also keep your list of medications for open enrollment and drug coverage every year in there. It will save that. It has other features such as electronic health records folder that you can provide access to your doctors with, and some other features. Certainly something that, again, Medicare encourages you to do if you have that ability. There are some benefits to doing it. It is not required that you create a My Medicare account. All right. So now we're going to talk about the parts of Medicare specifically. Going to start with Medicare Part A, which is for hospitalization or inpatient services. Things to consider. Do you need to enroll in Part A? If you are already collecting any sort of Social Security income when you become eligible for Medicare at any age for any reason, Social Security will automatically enroll you in Medicare, period. If you're entitled to Medicare Part A, based on having paid taxes and a work history, Medicare Part A is usually going to be free for most of us. And once you're enrolled in Part A, you cannot disenroll. But you will also usually be automatically enrolled in Part B as well, which is the part of Medicare we pay for. And you would be able to choose not to remain enrolled in Part B if you have a reason, a good excuse for not being enrolled. If you are not collecting any sort of Social Security income for any reason when you become eligible for Medicare, it becomes your responsibility to contact Social Security to let them know if you want to enroll in Medicare when you're eligible. If you do not contact them, they will not enroll you. And there's only one good excuse Social Security will accept for not enrolling in Medicare when you are initially eligible. And we're going to talk about that in a sec. If you don't enroll when you are initially eligible because you weren't collecting income, and you go to enroll during another enrollment period, you may pay more for Medicare for having not enrolled when you were first eligible. And we're going to talk about all of that in more detail as we go. Basically, the only good excuse Social Security will accept for not enrolling in Medicare when you first become eligible is if you are actively employed with employer group health coverage, or you're covered under your spouse's employer group health coverage through active employment, period. No other excuse is acceptable for them. Yes?
And then maybe discussing this, but if you want to remain employed and you do get insurance, but you can still put in for your Medicare at the normal time.
So the question is, can you remain employed with employer group coverage and enroll in Medicare when you are initially eligible? Yes.
Okay.
Yes, you can. There are pros and cons to doing that. And a lot of it may depend on how good your employer group coverage is or how expensive it is. Because if you work for an employer that has more than 20 employees and you're turning 65, the employer coverage is always going to be primary. And so there may not be much of an advantage to enroll in Medicare as a secondary insurance. But there may be. If your employer coverage has a $10,000 deductible that you have to meet before it pays anything, then there might be advantages to enrolling in Medicare as secondary. So it really, really depends on your situation specifically. That is one of the benefits of the SHIP program and having SHIP counselors available, is we can talk to people one-on-one about their specific situations and help them determine what scenario is going to work best for you based on all of those factors. In order to get Medicare Part A at no premium, you would have had to pay into the Social Security tax system or the Medicare tax system for a total of 10 years of work history. Those 10 years are accumulated or acquired over the course of your entire work lifetime. So they don't have to be accumulated consecutively or all at once. They can be accumulated at any time during your work history over the course of 30 or 40 years. So if you got a job right out of high school or college and worked for a few years, and then say you became a stay-at-home mom for 20 years, and then you went back into the workforce, your years continue to accumulate based on work only. So as soon as you have a total of 10 work years into the system, you will automatically become eligible for Medicare Part A with no cost, no premium. They call those 10 years of work history quarters. They break them into 40 quarters. So as long as you earn your 40 quarters, you get Part A for free. If you have less than 40 quarters paid into the tax system when you become eligible at 65, you can purchase Medicare Part A, but it's not cheap. It can be as high as $458 per month just for Part A. It is Social Security that determines who is eligible based on that work history. So they're the ones who keep track of that history, that work quarters. So if you're not sure if you have enough work quarters to be entitled to Part A at no premium, you would call Social Security and they would be able to tell you. Any questions about that so far? I did mention there's a test later, right? Maybe not. So what does Part A cover? Again, Medicare Part A is going to primarily cover your inpatient services. The most used inpatient service is going to be inpatient hospitalization for medical needs. Medicare Part A will cover all of the costs of an inpatient hospitalization regardless of why you're there for up to 60 consecutive days. They'll pay all costs minus a deductible per admission. So this year, the deductible for inpatient hospitalization is $1,408 per admission. So every time you are admitted to the hospital, Medicare will pay everything minus that deductible. And that covers you up to 60 consecutive days in the hospital. Luckily, most of us don't stay in the hospital that long. They try and get us out of there as quickly as they can. But if for some unfortunate reason you were still in the hospital more than 60 days, starting at day 61, Medicare would continue to pay for that stay, but they would start applying a daily co-insurance, meaning a daily amount that they will not pay that would become your responsibility. For 2020, that daily co-insurance starting at day 61 is $352 per day. And that would cover you up to the next 30 consecutive days. And then if you're still unfortunate enough to be in the hospital after 90 days, that co-insurance per day goes up to $704 per day. Fortunately, that should be a very, very rare scenario that any of us are in the hospital more than 3 to 5 days. Medicare considers 90 days as a benefit period for this purpose, but you have to have 60 days, 60 consecutive days from the time you are discharged from the hospital to the time you might be readmitted to the hospital before they'd be able to apply that deductible again. They consider a benefit period 90 days. And once you're in the hospital as an inpatient for more than 90 days, you start going into what they call lifetime reserve days. So Medicare really doesn't anticipate anybody being in the hospital for more than 60 days. Certainly much rarer that you'd be there for more than 90 days. And if for some reason you have to be there for more than 90 days, you start going into a 50-day lifetime reserve amount. That once that's exhausted, it's gone. Otherwise, the benefit for Medicare inpatient coverage is without limit. So it doesn't matter why you're in the hospital. It doesn't matter what the cost of the service is that you're in the hospital for or how long you're there. Medicare will pay for anything that you need as long as it's medically necessary. And per benefit period, they will pay everything except for those costs. So there is no lifetime maximum for inpatient hospitalization. There is a lifetime maximum for inpatient psychiatric hospitalization. Medicare will pay a maximum of 190 days of inpatient psychiatric hospitalization in your lifetime. But for medical hospitalization, there is no limit. There is also no out-of-pocket limit. So there is no limit to how many times that deductible can be applied, except that there has to be that 60 days in between discharge and readmission. But there is no maximum amount limit. And again, Medicare will pay for any service that you are requiring while you're inpatient in the hospital, regardless of what it is, or why it is, or how long it takes for you to get that resolved, as long as it's considered medically necessary. There are some things that are not going to be covered under Part A for hospitalization. Personal convenience items. Medicare will not pay for you to have a private hospital room unless it's deemed medically necessary. or even if there simply wasn't any other space available, but you can't choose or opt for that. No part of Medicare will cover the first 3 pints of blood someone might need. I really don't know why. I've looked, I can't find why. Nor do I know how much it cost, honestly. Although someone did tell me, somebody came back after a class, sent me an email and told me how much blood costs for those first 3 pints. I can't remember, it's been a few years, but no part of Medicare covers any part of the first 3 pints you might need for any reason, does not cover private duty nursing or room sitters, and does not cover what they consider self-administered drugs. Self-administered drugs are usually going to be what you are handed on the day of discharge. So say you're being discharged from the hospital, they've been giving you your regular maintenance medications while you're in the hospital. On the day of discharge, you're no longer considered inpatient. So if it's taken them forever to get you out of there, forever to discharge you, and it comes time for those maintenance medications and they hand you a cup of pills and you take them, you just self-administered your drugs because you're no longer considered inpatient in that hospital on day of discharge. In that scenario, theoretically, they could bill you whatever they wanted for those medications. No. Well, if you take it, it depends on how long it's taken them to discharge you when the doctor is discharging you. It's not something that happens very often anymore. It was something that was a pretty common concern a few years ago. But it's not something that we come across very often where people are being billed for medications on the day of discharge anymore. But it could happen. So it's just something to be aware of. Another thing you need to be aware of when it comes to inpatient hospitalizations is the difference between being admitted as a patient and being under observation in a hospital. If you have a medical emergency and say you go to the emergency room, and that emergency, the doctors determine that they need to keep an eye on you for a little while before they're comfortable sending you home. Just because an emergency room or a doctor takes you from the emergency room and sends you to a room upstairs in the hospital does not mean you've been admitted to the hospital. You could be under observation in a room. You could be under observation for days and never be officially admitted to a hospital. If you're not admitted officially by the physicians to that hospital, you're not inpatient. It's not a Part A benefit. Does that mean Medicare is not going to cover that observation? No. Medicare will pay for it under Part B. But it becomes a concern for people who would, after a hospital stay, need to go to rehab. Because Medicare will only pay for inpatient rehab or skilled care after a 3-day or more inpatient stay. So if you're under observation for a week and then sent to rehab, Medicare will not pay for the rehab because you were never admitted to the hospital. That was becoming a huge issue for Medicare beneficiaries as well, where they were not being told that they had not been admitted to the hospital. They were under observation. But then the providers at the hospital were sending them to rehab for recovery, and Medicare was not paying for the rehab. That's a really good question. I don't know why they would do that. And they should have to inform the patient of what's going on, but they were not. So Medicare created a rule, and now they are required by law to inform you within 24 hours whether or not you're going to be admitted or not, and if not, why. The form is called a MOON form, M-O-O-N. And honestly, I can't remember what the acronym is specifically at the top of my head, but it is something that the hospital is required to provide to you for signature within 24 hours of being in the hospital to advise you if you're being admitted or if you're not being admitted, why, so that you are informed. Again, because Medicare had to create a rule, it is not as big of a concern as it was even a year ago, just something that you need to be aware of. Medicare Part A also, again, covers inpatient skilled care or rehab. And again, for Medicare to cover that inpatient skilled rehab, They do require that you have an inpatient hospital stay of 3 days or more in order for them to pay for that rehab. If you have that 3-day or longer inpatient hospitalization requirement met when you're discharged to rehab, Medicare will pay 100% of that rehab care, that rehab stay, for the first 20 consecutive days. If you're still in the rehab facility on day 21, Medicare will continue to pay most of that stay, minus a daily coinsurance, meaning they'll pay everything except for, this year it's $176 per day. So the first 20 days Medicare covers at 100%. Starting at day 21, you have to start worrying about $176 per day, and that'll get you through day 100. If you are still in the rehab on day 101, Medicare honestly no longer cares why you're there because they're going to stop paying for that coverage or that benefit altogether. So Medicare considers a 100-day period your benefit period for skilled inpatient rehab. And if you have not gotten well enough to go home, even if it's to go home with continued at-home rehab, you're still there on day 101, Medicare starts to consider that stay custodial or long-term care and no longer medically necessary. Yes, ma'am. Is that lifetime benefit? No. You get an unlimited number of 100-day benefit periods, as many as you need for the rest of your life. The 100-day benefit periods are consecutive day stays. And again, you have to have 60 days from the time you're discharged from rehab to the time you're readmitted to rehab before a new benefit period would start. That is,
It's not like somebody can just go home for 3 days and then go back to the rehab.
so if you're in rehab, you're discharged, you manage to go home, and after 3 days, you have to go back to rehab for some reason. When you go back to rehab, you start where you left off in the count of 100 days. So you're still in the same benefit period, and they just keep counting. You have to have that 60 days between the time you're discharged and readmitted before a new 100-day benefit period starts. And another 3-day inpatient hospital stay, correct. And again, if you're still there for some reason on day 101, it becomes long-term care. Medicare coverage stops completely. And you would have to consider how you were going to continue to pay for that care, whether it be out-of-pocket private pay. Maybe you have purchased long-term care insurance to help cover that cost, or perhaps even long-term care Medicaid might be appropriate in that situation. Medicare Part A also provides home health care benefits of Medicare and hospice care, end-of-life care with Medicare. For those two services, Medicare does require that a doctor certify your eligibility and the necessity for that need for that care. Deductibles usually do not apply to those services, and Medicare will pay 100% for those services unless you're part of that service is being provided with a wheelchair or a walker or oxygen, then Medicare will pay 80% of those durable medical supplies. And some limits do apply. However, Medicare has eliminated the limit on how often or how many times you can get service for home care. There used to be a dollar limit on how much home care somebody could get, and that dollar limit or any limit to getting home care has been removed by Medicare. Yes, ma'am.
Is this referring to the hospice care part at home hospice care or at hospice?
Okay, so regarding the hospice benefit, Medicare will pay all costs for any services that are provided for hospice, which again is end-of-life care, so it's going to pay for services that are going to make someone comfortable. If your services are being received at home, 100% covered. What this benefit will not pay for is room and board. So if you are receiving hospice services at a facility, they'll pay for anything and everything except for the room and board at the facility. That would be an out-of-pocket. And again, it's going to pay for any service that would be available to make someone comfortable at an end-of-life situation. eligibility for hospice benefits. A doctor has to potentially certify that you have 6 months or less to live. But that certainly does not mean you have to die in 6 months. People can be on hospice indefinitely as long as they continue to meet the criteria, because a doctor does have to certify to Medicare that that eligibility still exists every 60 to 90 days. Same for home care. Home care will be continued coverage or benefit as long as it is either improving your condition, maintaining your condition, or slowing the decline of your condition at this point. It will not pay for homemaker services though. It'll pay for medical need services, but it's not going to help pay for someone to come in and, vacuum and do the laundry and stuff like that. The key to Medicare benefits is medical necessity. If the need is medically necessary, then Medicare should pay for whatever you need. So that's Part A benefits in a nutshell. Any questions about any of that? You sure? Okay. Then we'll move on to Part B. Medicare Part B is going to be your outpatient services. Things to consider, again, should you enroll in Part B or will you be enrolled in Part B? If you are collecting a Social Security income of any kind for any reason at any age, when you become eligible for Medicare, Social Security will automatically enroll you in Medicare, A and B. But again, if you are still actively employed with group coverage or covered under your spouse's active employment group coverage, you can delay enrolling in Medicare. It's the only good excuse Social Security will accept for not enrolling at first eligibility. Everybody pays a premium for Part B. So we work and pay taxes to earn Part A at no premium. Everybody pays for Part B. There's no getting out of that. Part B premiums are always going to be deducted from a Social Security income when you are collecting one. So even if you're going to delay collecting Social Security income for your full retirement age of 66 or 66 and some months, but you enroll in Medicare at 65, you're going to pay those premiums directly to Medicare until you start collecting a Social Security income, and then they will automatically start deducting those premiums from that income. You'll have no choice about that. There are some situations where you might be required to enroll in Medicare. If you are retired military and have access to TRICARE healthcare, TRICARE, standard or prime, requires anybody who becomes eligible for Medicare to enroll in Medicare, or you will lose your TRICARE benefits completely. If you want to get additional coverage to go with Medicare, such as a Medicare Supplement or a Medicare Advantage plan, you have to have both Parts A and B of Medicare to enroll in those coverages. If you are a veteran and you are using the VA system for your health care and drug coverage, VA health system is not considered health care coverage or health insurance. You don't have to enroll in Medicare. You don't have to enroll in any of this. And certainly Medicare, because you have to pay a monthly premium, is optional. But because the VA health system is not considered health insurance, if you don't enroll in Medicare Part B in favor of using the VA and you need to enroll later down the road, you would be penalized. You'd pay more for Medicare for not enrolling when you were first eligible. But again, if you're still working, if you're still actively employed or covered under your spouse's employment employer group coverage, and you choose not to enroll in Medicare because you are still actively employed, when you stop working, whether your health coverage continues or not, when you are no longer actively working, you will have up to 8 months to enroll in Medicare without penalty. Yes, ma'am.
Because I don't want to gap in coverage when I retire.
Hmm?
If I apply, because I got Part A once I but after I retire with Part B, how long does it take to get it?
So the question is, if you turned 65, you went ahead and enrolled in Part A because it's free, but you are still covered under employer coverage, how long will it take to enroll in Medicare once you quit working for Part B?
How long will it take to get Part B? Just trying to
It takes a phone call.
Just a phone call?
Takes a phone call. You're going to have to prove to Social Security that you had employer coverage. So you're going to have to have your HR fill out a form that indicates your coverage range or your date span. But, you know, theoretically, you can ask them to backdate it if you need them to, if you're willing to back pay the premiums. So it shouldn't take more than a phone call and providing that form that proves you had employer coverage through active employment up until that specific date. But if you know when you're going to stop working, you have that date, you can contact Social Security anytime prior to that and say, I would like my Medicare Part B to start on this date, the day after you quit working.
So that form that your employer needs to take, you have to take it into them, you can't submit it online, is that correct?
The form that Social Security will require the employer to complete is usually sent in by the employer.
Okay.
So you may have to get the form from Social Security and take it to the employer. But once the employer fills it out, they can submit it directly to Social Security for you. They should submit it directly to Social Security for you. Yes, ma'am.
So if you're working and you want to enroll in Part A, because it costs nothing,
Mm-hmm.
you can do that. If you're working and you enroll in Part B, you have to pay a premium.
Mm-hmm.
How will you pay that premium?
So the question is, if you are working with a group coverage, but you want to go ahead and enroll in Medicare A and B, how would you pay the Part B premium? Again, you're going to pay that premium directly to Medicare. Social Security will typically either bill you quarterly for that monthly amount, or just recently in the last couple of years, they have finally come up with the times and you can arrange automatic bank draft from your bank account every month versus the quarterly bill.
I know it depends, and that is very subjective. I mean, it depends on, is there a set price, in other words?
That's what we're going to talk
Oh,
about
okay,
next.
fine. I'm jumping ahead, I'm
Yeah,
sorry.
that's all right.
Okay,
So again, actively working, you stop working regardless of when your health coverage ends. As soon as you are no longer actively working, that's when your 8-month clock starts ticking to enroll in Medicare. Some people will opt to take advantage of COBRA coverage from the employer during that 8 months. Some people will not. It may not be financially viable to do that. But if you let that 8 months expire without enrolling in Medicare, then there's only one other opportunity for you to enroll in Medicare, Part B or A, which would be during the General Enrollment Period. The General Enrollment Period happens every year between January 1st and March 31st. If you're enrolling during the General Enrollment Period, your coverage will not start until July 1st of that year, and you will pay more for Medicare. Simply because you're enrolling during that General Enrollment Period, that means you missed your other opportunities, and now they can penalize you for not enrolling sooner. So how much is that going to cost you? The base premium for most of us for 2020 is $144.60 per month for Part B. However, Medicare premiums are now means tested. And what that means is the higher your income, potentially the higher the Part B premium you may pay. Fortunately, that threshold is pretty high. So as a single person, your annual income based on filing income tax would have to be $86,000 per year or more before you'd have to worry about paying a higher Part B premium. And you would simply double that for a married couple. And what Social Security is going to base that on is the most recent complete income tax filing that they can access, which may be a year and a half or 2 years old. So if you had a significant income a couple of years ago, in the meantime, you have retired and you no longer have that high of an income, what Social Security is going to do is send you a notice that says, we looked at your tax records and we think we can charge you a higher premium. But if that is not your income, when you receive that notice, you simply let them know that is no longer your income. That penalty or that higher amount that you may be required to pay will vary from year to year based on income changes. So they may be able to apply it for the first year or two, but when you retire, your income is reduced. You simply let them know that, and the premium would be reduced as well. So it's not a lifetime increase to your premium if your income changes. Otherwise, again, that monthly premium, once you're collecting in Social Security income of any kind will be automatically deducted from that income every month. It can also be deducted from a railroad retiree income check or even a federal benefits check, federal retiree benefits check. They used to deduct it from para-retiree incomes as well, but I think they stopped doing that about 1.5 years ago. Part B services also have a deductible. It's an annual deductible and not a per service deductible. 2020 Part B deductible is $198 for the year. A drop in the bucket compared to most deductibles these days. Once that deductible is met for the year, then Medicare pays for most Part B services at an 80-20. They pay 80 of what's allowed and you pay 20% of that cost. For people who are becoming eligible for Medicare after the first of the year, Medicare calculates everything on calendar years and calendar months. So they like things to start at the beginning of a month, beginning of the year. But if your Medicare enrollment starts in June, that deductible is going to be applicable to whatever services you have first after June 1st for the calendar year of 2020. And then every year after that, the deductible will be applied to whatever service you have first after January 1st, because it will start a new calendar year. So what do you get for $144 and change? Again, Medicare Part B covers most all outpatient services. So office visits of any kind, primary or specialist, all your medical, surgical, and anesthesia services, Medicare will pay for medical second opinions. Do you have a question?
Yes, I heard that doctors are reluctant to take on Medicare patients because their reimbursement rate is low and they're slow to reimburse the doctors. Can a doctor decline to take Medicare patients?
So the comment question is, doctors can be reluctant to accept Medicare due to low reimbursement and low or slow reimbursement. Doctors' participation in Medicare is absolutely positively voluntary. They do not sign a contract with Medicare. If they choose to accept Medicare patients, they are bound by all the Medicare rules and regulations, federal and state rules. But they don't sign a contract that says they have to take Medicare. So even if a doctor agrees to participate with Medicare and can take Medicare, that doesn't mean he has to take Medicare patients. That doesn't mean they are not going to limit how many Medicare patients they have at any given time. There are many offices in this area that prefer people who have Medicare to only have a Medicare Advantage plan. They'll only take a new patient if they're enrolled in an Advantage plan versus original Medicare. As far as reimbursement rate and timely payment rates, I don't buy that. Medicare's billing system went electronic about 12 years ago, and ever since then, doctors are reimbursed within 30 to 45 days. Medicare is a federal nationwide insurance coverage that, quite frankly, probably sets the standards or the rates for medical coverage. I honestly can't see a private insurance company shout out to the world that we pay more than Medicare. So I hear doctors tell people that, and I just hear that general thought process pretty commonly, but I don't think it is applicable as it is implied to be. There are plenty of doctors that take Medicare. There are more than people realize. If you open the phone book and you just start calling numbers to try and find a doctor, yeah, you might get pretty frustrated pretty quick. But there are plenty of doctors, and many of the larger groups of doctors in this area specifically are happy to take Medicare. If anybody's having difficulty finding a doctor when they get Medicare, we do keep a list here of doctors in this specific area, Colorado Springs area, of doctors who are taking new Medicare patients, and I try and update that every 6 months just for that reason. But quite honestly, my list has been getting bigger over the last couple of years of doctors who are taking patients. Doctors are starting to move into this area, luckily. Yes, ma'am.
This screen that you have up here, when you say this is covered, for instance, lab x-ray, is that 80% or 100%?
So most of these services, again, are going to be covered at 80%. Some services will be covered at 100%. Most blood work is covered at 100%, most lab tests. Vaccines are usually covered at 100%. That is probably after the initial annual deductible, yes. The deductible? So how the deductible is applied, come January 1st, you have a doctor's appointment. You haven't met your deductible for the year. Excuse me. You're going to go to the doctor's appointment. The doctor's going to bill Medicare whatever that cost is for the appointment. Medicare gets that claim, and they're going to see that you have not met your deductible for the year, and they're going to apply the cost of that appointment, whatever the doctor billed them, to that deductible. So basically, they're going to respond to the doctor and say, we're not paying you anything because we applied it to deductible. Once the doctor gets that bill or gets that statement saying Medicare is not going to pay him for that service, it could either go to another insurance if you have one, or that's when they're allowed to bill you whatever Medicare says they applied to that deductible. Then you pay the doctor directly. You don't pay it up front. You don't pay the whole thing at once. It's based on who bills Medicare first every year and how much they bill them. It may take multiple providers and provider visits to meet that deductible. It may be met in one visit. But because the doctors don't know if the deductible has been applied until they bill Medicare and Medicare responds to that, they shouldn't be trying to get that up front. So it's hard to find out how much you might cost. Yeah. And that's yeah, and doctors' offices cannot tell you because Medicare will not tell you how much a service may cost or how much your cost may be in 20%, because they cannot tell you if they're going to pay for something until you've received that service and the doctor submits the claim. And until they know they're going to pay for it, they can't tell you exactly what it would cost. No, honestly, I'm glad it's that way versus them flat feeing everything no matter what you needed. So what the doctor bills is specifically for what you needed and not just because. I mean, if he could bill a flat fee because, whether that's what you needed or not, that would certainly make our medical costs a little higher, I think. So it's not a bad thing. The bottom line is your maximum liability is going to be that deductible and 20%, which is going to be 20% of anything that you ever need. All things considered, that's not bad. Yes, ma'am.
On that, blood beginning with point, does that include the hemophilia patient?
So the blood benefit, so again, Medicare, now Potter Medicare covers the first 3 pints of blood somebody might need, usually going to be referenced to a transfusion of some sort. And Medicare Part B starts paying for blood on pint number 4. And the question is, does that apply to patients who with hemophilia? Yes. Yes. Yeah. Because no part of Medicare covers any of the first 3 pints of blood somebody might need. Now, that's not an annual benefit, that's a benefit. So once that first 3 pints of blood has been received, or per what's the word I'm looking for, per episode. So if it's an ongoing episode of needing blood transfusions, once those first 3 pints have not been covered, then Part B pays for everything after that. Okay, so again, Part B, let's finish going down the list. Ambulance rides are covered in medical emergencies. Annual flu shots, hepatitis shots, pneumonia shots, shingle shots. There's double asterisk next to the shingle shots because shingle shots are covered in 2 ways. The shot medication itself that is injected is covered under your Medicare drug benefit, Part D. The administration of that injection is covered under Part B, which makes it a little more complicated for the providers to submit for you, which is why many pharmacies now have a nurse on staff who can administer that injection of shingle shot at the pharmacy, because doctors didn't want to do it, because then they'd have to bill Part D for your drug. So it's easier for pharmacies to do it that way, but the shingle shot is paid for by both Parts B and D of Medicare. Part B also covers all your outpatient physical therapy, occupational therapy, and speech therapies, pays for the durable medical equipment, wheelchairs, walkers, oxygen, and supplies. Has coverage, some limited coverage for other services such as chiropractic, podiatry, optometry. There are some things Medicare Part B will not pay for, starting with routine annual physicals, routine foot care, hearing aids or the fitting of them are not covered, routine eye exams or the glasses associated with them, not covered. And even in a medically covered eye service, if you get a refraction of the eye, Medicare will not pay for the refraction. Medicare does not cover dental in any way, shape, or form right now, although that is a discussion on the table, surprisingly. Nor will they cover anything considered cosmetic. Those are all non-covered. Having said that, though, Medicare has jumped on the preventive care bandwagon, and many of the services that they used to deny coverage for as routine services are now covered as preventive services. Although Medicare will still not cover a routine annual physical, so if you're used to going to your doctor once a year and they put you on the treadmill and they take some blood tests and all that, Medicare doesn't pay for that. What Medicare will pay for when you first become eligible or enrolled in Medicare is a welcome to Medicare preventive visit with your doctor. This is not a physical. This is a in-depth conversation with your doctor about your medical history, your family's medical history, your social history, your mental health, all those kinds of things, but it's not a physical, it's a discussion. That discussion establishes a baseline and provides the doctor with recommendations and suggestions for you for future preventive services. That is a use it or lose it benefit. You have 12 months to use it or lose it from the time your Medicare first kicks in. Regardless of whether you take advantage of that preventive visit, every year thereafter, you would have the opportunity to have an annual wellness review. Again, simply an in-depth discussion with your doctor about the previous year's history, medical history, social history, mental health, so that the doctor can potentially suggest future preventive services that might be of benefit for you. That's Medicare's answer to the routine physical. There is a huge list of what Medicare covers under preventive care. And as of January 1st, 2020, Medicare pays for anything they classify as a preventive service at 100%. The best way to find out what preventive services are covered by Medicare, honestly, is the Medicare You handbook, either in paper copy or you can go to the medicare.gov website and download it as a PDF. There's like a 20-page section in this handbook that details all preventive covered services. It tells you what the criteria is to be eligible to get that preventive service covered and how often you can get it. And it's always going to be indicated in the book with a little blue apple next to it. So you get the descriptions, and then there's a little blue dot, that's an apple. That means it's a preventive service covered by Medicare. It's a big list, and they continue to add services to this list every year. So that is Part B in a nutshell. Any other questions about those benefits? Yes, sir.
Per episode, when you go to the doctor in your hospital, you are having all these bills coming in. Should you just wait then for all the bills to come in and see which one to pay to get your deductible met, the 100 and...
So the question is, if you're getting multiple services in a short time frame, how do you determine what bill is for the deductible and what bill to pay in regards to that?
Let's say you have 5 bills and, one covers that deductible and then the rest of them, you should not pay until they rebill it?
Well, if you don't have insurance that's going to pay that 20% for you, then you should probably pay all those bills when you get them as long as Medicare has paid their part. But billing statements will usually indicate that Medicare applied to deductible, and that's why you're getting the bill. So it will usually indicate on the billing statement itself that it was Medicare applied to deductible. But if you're not sure, you can always call Medicare, call the provider or their billing department, or you can try and go online to the My Medicare account and look at the claim yourself. And it will tell you if it was applied to deductible, which provider, and how much. However, if you have an insurance that's designed to cover the 20% after Medicare, then that would be the only cost you'd have to worry about. If you don't have insurance that's going to pick up that 20% after Medicare pays their part, then you should probably pay all those bills regardless, because there's nothing else out there that's going to do it for you. You guys want to keep going, or you want to take a 5-minute break? We're about halfway through. Keep going? Okay. I'm not seeing anyone get up, so we're going to keep going. Any other questions about A and B benefits before we move on? Okay. So now that you have A and B of Medicare, there are a couple of different kinds of insurance coverage that you can get to go with A and B of Medicare, or as part of your coverage. And these are benefits that you would look at if you do not have the option of retirement health coverage through an employer or past employer, or if you're not military retiree. So these are the benefits, these are the kinds of coverages that you would look at if you don't have other options, or you would compare to those other options. But if you have the option of considering retirement health care through an employer or past employer, those are options that you should certainly look at. If you are a para-retiree or a federal retiree or a military retiree, then certainly those are benefits you should consider very strongly before you look at any other coverage that might be available to go with Medicare. The para-care. So we're not going to talk in detail about any of those retirement options, but para-care for public employees is a retirement health system that you pay into. Federal retirees also, civil service, federal, and of course retired military, which we have plenty of in this area, have access to the TRICARE. But if none of those are options for you, then the first thing that we're going to talk about are Medigap policies or Medicare supplements. Medicare supplements and Medigap are two terms for the same thing. Medicare supplement, Medigap, same thing. And what it is, what a Medicare supplement is a private health insurance policy that you purchase from a private insurance company. And it is solely and specifically designed to pay the balance that Medicare Part A or Medicare Part B left over after they paid for a service first. Period. Let me say that again. Medicare supplement policies are private policies you purchase from private insurance companies, and they are solely and specifically designed to pay the balance that Medicare Part B or Medicare Part A left over after they paid for a service first. Yes, ma'am. Does that include the deductibles of Medicare? It includes the Part A deductible. But if you are becoming eligible for Medicare after January 1st of 2020, you would not have the ability to buy coverage that would cover the Part B deductible. If you're eligible for Medicare prior to January 1st of 2020, you may have the option of purchasing a Medicare supplement that would cover both A and B deductibles. And we'll talk about that a little bit more in a minute. So Medicare supplements are designed to supplement the balance that Medicare left over. After they paid for services first, they paid their part. These policies are required to follow all federal and state rules and regulations. The term Medigap comes from the thought process that it covers the gaps in your Medicare coverage, the 20%, the deductibles. But I've been doing this a long time, and Medigap is a pretty fandangle new term for me, so I still call them supplements. Medicare supplements are standardized, meaning there are a limited number of levels of coverage that you can choose from to purchase as a Medicare supplement. And those levels of coverage are set in stone. They're standardized, meaning any company that sells Medicare supplements sells the same coverages, same levels of coverage. Except in 3 states, Massachusetts, Minnesota, and Wisconsin, where they have some additional options. Because everybody is selling the same levels of coverage, cost will vary by state, by plan, by company, by age, by sex. Any number of factors can influence the difference in cost from one company to another with the same coverage. Kind of like buying car insurance. If you call 5 different car insurance companies for a price quote on the same level of coverage, you could get 5 very different price quotes. Same kind of thing. They're all selling you the same thing, but the cost will vary. So Medicare supplements only work with original Medicare. If you are getting a Medicare supplement, original Medicare A and B are your primary insurance. The supplement would be your secondary insurance. If you already have a Medicare Advantage plan, if you have TRICARE for Life or Para or something like that, you may not need a supplement. If you have an Advantage plan, you can't get a supplement. But if you have retiree health benefit options, you don't need a supplement. Because Medicare in this scenario is your primary coverage, Medicare is a federal nationwide health benefit that is good anywhere with any medical provider or service that takes Medicare for any medically necessary reason anywhere in this country. And as long as Medicare pays their part for any reason, the supplement would pay the balance. So it's not limited to where you are in the United States and or our territories, but it does not cross the border of the United States and or our territories. So it's no good outside of this country. But it does make it the most portable way to have Medicare, especially for people who maybe snowbird between here and another state, or simply travel often or a lot, or plan to live on the road when they retire, who knows. But because it's not limited to a specific region or area, it does travel very well. And again, as long as Medicare pays their part for any reason anywhere, a supplement will pay the balance. On the other hand, if Medicare does not cover a service, the supplement will pay nothing either. So it's not there to pick up if Medicare doesn't pay, it's only there to pick up what Medicare left over after they paid. What would be an example of Medicare not paying for something? Typically, if Medicare denies something, 90% of the time it's going to be a billing error. Unless your doctor tells you up front or your provider tells you up front that they don't think Medicare is going to pay for something and give you the opportunity to decide if you want to go ahead with that service or not, Medicare should pay for everything. The only time Medicare will not pay for something is if it's deemed not medically necessary or not a covered benefit. So usually Medicare denials are billing errors that can be corrected and resubmitted, or you knew it wouldn't be covered because they told you it wouldn't be covered and made you sign a piece of paper telling you that. So potentially there shouldn't be any situations where Medicare doesn't pay for something that you needed to have done. Doesn't mean it doesn't happen for those reasons, but it's a rare occurrence, and it's usually something that's corrected by calling the provider and asking them to do it again. But again, Medicare only pays for medically necessary services, so if you have a service that's deemed not medically necessary or not a benefit of Medicare, Medicare will not pay for it. But that shouldn't be very, very many services. Yes, ma'am. Medicare coverage will not extend beyond the borders of the United States of America and or our territories, period. you have a question?
If you already have A and B, how long do you have if you want to get it?
That's what we're going to talk about next. So Medicare supplements have specific timeframes that are better to purchase them than others. You can buy a Medicare supplement at any time once you become eligible and enrolled in Medicare, and they will sell you a Medicare supplement as long as you can pass underwriting most of the time. What that means is they're going to look at your health history, your medical records, and if they don't like what they see, they don't necessarily have to sell you insurance. It's an all or nothing deal. They either will sell it to you or they won't, unless you are in guarantee issue. Guarantee issue is an opportunity for you to buy coverage, a Medicare supplement, any level of coverage from any company you want without underwriting. But that guarantee issue is limited. So when your Medicare enrollment starts, you have both A and B, you get 6 months based on just enrollment into A and B. Once that 6-month clock starts ticking, you cannot stop it. So you have a 6-month window of guarantee issue where you can buy any plan from any company without any questions asked. They have to sell you whatever you want.
So if you've not been taking B because you're still working, 6 months starts when you start B.
Correct. So if you delayed Part B because of employment, when you enroll in Part B, when you're no longer employed, that's when your clock starts ticking. It can't start ticking until you have A and B. Yes, yes, ma'am.
Do you know if you're more likely to pay more if you have a Medicare program versus an advantage policy?
So the question is, do you pay more for Medigap or more for Advantage plan?
I mean, out of pocket after they pay their part.
That is a much more complicated question than it sounds like. But we're going to talk about that a little bit. Yeah, we'll talk about costs. Yeah. So, yeah, we'll talk about costs for both of those. So for people who are just becoming eligible for Medicare at 65 or even on disability under 65, for many people, that 6 month of guarantee issue can be very important if this is the kind of insurance that they are leaning towards, especially for those under 65 on disability, which would be pretty much the only reason you'd have Medicare at under age 65 is because you've been deemed disabled by Social Security. If you don't buy that Medicare supplement within that first 6 months of guarantee issue, you may not ever have a chance to buy a Medicare supplement because of underwriting. Again, you can apply for a Medicare supplement at any time, but they will underwrite most of the time. And if they don't like what they see in your medical records, your health history, they will not sell you insurance. It's not that they will sell it to you for a higher price. It's an all or nothing deal. They will or they will not. So for people under 65, that can be a much more important decision to make or a much more important piece of information to know. For people over 65, it's nice to know that, especially if you have any sort of pre-existing health issues, because once that 6 month window expires, if you try and buy this kind of coverage, you are subject to underwriting, and they may not sell it to you with pre-existing health issues. But if you're healthy enough to pass underwriting at any time, they'll be happy to sell you insurance whenever. Obviously, that 6 month window of guarantee issue is going to be one of the best times to try and buy this kind of coverage. But again, once that clock starts ticking, you can't stop it. That doesn't mean once you enroll in something, that's it. Theoretically, you could enroll in a different Medicare supplement every month for those 6 months with guarantee issue. But once it expires, there are very, very few situations that would give you another opportunity to get a Medicare supplement without underwriting. But there are those opportunities. They're called special enrollment periods, and they're primarily going to be based on involuntary loss of other coverage. For example, your employer coverage ends. So you turned 65, became eligible for Medicare, enrolled or did not enroll in Part A, but did not enroll in Part B because you were employed with coverage. When that employment ends and you enroll in Part B, that's a special enrollment period based on just enrolling in Part B due to loss of employment. Even if you have coverage through retirement benefits, and that coverage has been coordinating with Medicare. I see, unfortunately, more employers dropping retiree benefits for their retirees as a cost-saving measure. If you involuntarily lose retirement health care that's been coordinating with Medicare, that provides an opportunity to get into a supplement because that loss of coverage is not your fault. So involuntary loss of coverage, it wasn't your fault that that coverage went away. Medicare will always provide you an opportunity to get into other coverage that is offered. Medicare's goal is not to leave you out in the cold or leave you uninsured or uninsurable through no fault of your own. So you should always have an opportunity to get something else if you lose coverage, not through your choice. There's also an opportunity based on enrollment into a Medicare Advantage plan, but we'll talk about that when we get to Advantage plans. It's a little easier to explain. But involuntary loss of coverage is the key to any other opportunity you would have in the future for getting into a supplement without underwriting.
That still stops your insurance.
It still stops your insurance. And if it's beyond your initial 6 months of having enrolled in Medicare Part B, you still get a 63-day window. So there's always going to be some time frame of opportunity for you to get other coverage guaranteed. But like Medicare, there are some things Medicare supplements do not pay for. I've already discussed that if Medicare denies something, they don't pay for it either. Other things not going to be covered are long-term care, because it's not a benefit of Medicare. Vision or dental, because they're not benefits of Medicare. Hearing aids, private duty nursing, outpatient drugs. So basically, if Medicare doesn't pay first, the supplement pays nothing. It's all tied together. In your folder, there should be 2 handouts regarding Medicare supplements. The first handout is going to be a multi-page packet, and it's going to say Medicare Supplement Insurance Policies in Colorado, August 2019. The second handout is a 1-page handout, bunch of boxes, and it says 2020 Standardized Medicare Supplement Plans. We are fortunate enough in the state of Colorado that our Division of Insurance takes the time and effort to put this multi-page packet together for us. Because what this packet is a list of all the companies that are licensed to sell Medicare supplements in the state of Colorado. It lists all the plans that each one of these companies sells, and it gives you approximate monthly cost per month for these plans with these companies. The 1 page is going to detail the plans that you have to choose from. These are the levels of coverage that are set in stone, the standardized supplement plans. I always encourage people who are looking at this kind of coverage to pick a plan first. You pick the level of coverage that you are comfortable with, and then you start shopping around for the best deal for that plan. Again, these plans are standardized, meaning they're set in stone, so these are the only options you have to choose from for coverage as a Medicare supplement. And these plans, each plan is slightly different. They're labeled A through N, kind of like the alphabet, but not exactly. So Medicare Supplement Plan A and B and C and D, and so on and so forth. These are plans versus Medicare Parts A and B. So these are the plans you get to go with Medicare Parts. Under each letter designation of these plans, there is a descriptor of what the plan will pay for. The more boxes that are filled in under the plan designation, the better the coverage. the more it will pay after Medicare pays their part. So for example, on this chart, Medicare Plan A only has one box with information under it, which says basic benefits, including the 100% Part B coinsurance, or 20%. That's all Plan A supplement covers, is the other 20% for Part B services and the basic benefits that are detailed underneath. Supplement Plan B covers the basic benefits, the 20% for Part B services that Medicare left over, and it also covers the Part A inpatient hospital deductible every time you're admitted as an inpatient. But that's all Supplement Plan B pays for after Medicare pays first. Starting with Plan C or D, depending on when your Medicare eligibility is effective, not only do they pay the Part B basic benefits, 20%, and the hospital inpatient deductible every time you're admitted, it also covers the skilled nursing coinsurance, that $176 per day starting on day 21 of skilled care. Plan C, if you're eligible to purchase it, also covers the annual Part B deductible, $198 this year. Plan D does not. And both of them have some foreign travel emergency benefit. As you go across the top of this chart and look at these individual plans, that's how it's detailing what you purchase based on the plan and what it covers. Again, if you are eligible for Medicare after January 1st, plans C and F are shaded because those plans are not available to you for purchase. If your Medicare eligibility was prior to January 1st of 2020, you have the option of purchasing a Plan C or an F. The only difference between those two plans and Plan D and G is the Part B annual deductible. So C and F include the Part B deductible benefit if your Medicare started before January. If your Medicare starts after January, you don't get the opportunity to have that benefit. Yes, ma'am.
If you have a Medicare supplement plan, can they ever drop you because you start incurring a lot of medical expenses?
So can a supplement drop you if you start using the coverage? Absolutely not. Once you are in with these companies, you pick a plan, you're in guarantee issue, you enroll. Once you're in, you're in. The only reason they can ever drop you is for non-payment of premium. Everybody pays the same amount depending on where you live and your age. So these plans cannot base your premiums on your health or your pre-existing health issues. They can only base your premium on your age and where you live. Once the premiums are determined, that's what everybody pays who is turning 65 in your area will pay. So they can't individualize the premiums or the amounts that you pay per month, but it's insurance. So you do have to count on the fact that there are going to be premium increases every year at least, just like any other kind of insurance. Another thing to consider is the Medicare premiums increase every year. The deductibles increase every year with Medicare. The co-insurances that they leave over increase every year. Insurance costs increase. I've never seen them decrease, but that's something to be aware of, that if you don't purchase additional coverage like a Medicare supplement to go with your Medicare, those deductibles, those co-insurances will go up a little bit every year, and the premium goes up for everybody every year. So again, I encourage people to pick their plan first, pick the level of coverage that you are going to be comfortable with for the long haul, because this may be the level of coverage that you have to go with your Medicare for the rest of your life. Once you've picked your level of coverage, then you can go to the multi-page handout. The first several pages of that handout is going to basically go over the same information that we've touched on. What is guarantee issue? When's the best time to buy coverage? So on and so forth. When you get about halfway through, you're going to see charts again. And at the top of the first page, in teeny tiny print in the middle, it's going to say age 65. Each page is a different age group. It lists, again, all the companies licensed to sell supplement insurance in the state of Colorado in alphabetical order, front to back of the page. It's going to have A through N across the top, just like on the one-page chart. If you go down the left-hand column where all the insurance companies are listed, and you go across the top with the plan that you choose to enroll in or that you're interested in enrolling in, if you intersect those two vectors, wherever they meet, if there's a number in the box, that represents an approximate monthly premium for that plan with that company. These are not exact premium quotes. These are estimates. They're ballpark. They're going to give you an idea of what that company will charge for that plan at age 65. So they're going to be in the ballpark, but they're not exact quotes. They're going to help you weed out the companies that are going to charge you more than you need to pay. They're going to help you narrow down the handful of companies that you should probably call before you pick a company to enroll with. Do you have a question?
Yes, are you allowed to go to a different plan in the open enrollment period?
There is no open enrollment period for supplements. There is no annual enrollment period for supplements. You get a 6-month window of guarantee issue or other special enrollment windows. Once you're in, you're in. There is no annual opportunity to change coverage.
65 and then next one 70, you just would guess it's in between those two.
Yeah, this is going to help you narrow down companies that you choose to investigate further or get more information from. It changes with age. Some companies may increase your premium every year when you have a birthday, and then they may increase your premium every year because it's a new year. Some companies will not. But certainly what this is telling you is what it would cost on average if you are enrolling for the first time with Medicare just going into effect at that age. Yes, ma'am.
Just to be,
Oh, go ahead. That's all right.
just to be specific, because the ages, the prices differences, you know, at age 65, is it automatically gonna, you're saying it won't automatically jump as much?
The
when you're
prices-
70. These are based on what your age is right now.
The prices that you see in here are going to be what, on average, you might pay to enroll in that plan with that company if you are enrolling for the first time at that age. It's not automatically going to jump up to that cost when you hit age 70, because 5 years from now, those costs will be different. This is based on initial enrollment. So the key code for the notes next to the insurance company names and numbers is going to be on the previous page, page 7. It's going to say whether that company bases premiums on attained age, issue age, community rated aging, whether or not they impose pre-existing condition limitations, whether or not they charge a fee for the application, all of those kinds of things, page 7.
So are you stuck when you select a company, let's say you want to go to a different company because their rates are better, they have better customer service? Would you then be subject to underwriting and they could say no, or what happens?
So again, once you're in with these companies, you're in, because there is no annual enrollment opportunity to make changes to your coverage or your companies. If you want to switch to another company or another plan level of coverage because it might be more cost effective, you would be subject to underwriting even if it's within the same company. Yep. Which is why I encourage you to be very comfortable with the level of coverage you choose and the company that you choose to purchase it from. Yes, sir.
So what happens when the company that you had the insurance with gets rid of that plan? Kaiser did that.
Okay, so Kaiser's not a supplement. Kaiser is a Advantage plan, different animals. But if for some reason you had a Medicare Supplement Insurance and a specific plan, I don't think I've ever seen a company drop a plan, Even if a company chooses to drop a plan and that's the plan you're in, you're still grandfathered into that coverage indefinitely for as long as you pay the premiums. So they can never take up the plan away from you, no matter what happens. Even if a company becomes insolvent or goes bankrupt and they stop selling insurance altogether and they have to take away your plan because they can't afford to pay it, that would be involuntary loss of coverage and you'd be guaranteed into another plan with another company. So that would be a perfect example of involuntary loss of coverage that would provide a special enrollment period. Yes, sir. So if you intersect a plan designation and a company's name and number, and there's no number in that box, that means that company does not sell that plan. Yes. Yep. You can do that. Correct. So if you get in with a company and you decide a year down the road or whatever that you don't like that company and you want to switch to another company, you can do that as long as you can pass underwriting or you have an opportunity with guarantee issue to do so. Now you guys are making me feel like I'm telling you bad news. This is not really bad news. Kaiser's not a supplement. Kaiser's an Advantage plan. It's different animals. So Medicare supplements, once you pick that level of coverage, once you have that plan, will always pay what it's designed to pay forever and ever and ever. It will always pay the Medicare hospital deductible. It will always pay the 20% for Part B services. It will always do what you buy it to do, as long as you pay your premiums. And the older we get, the more likely we're going to use services and incur those costs and use those policies. But these are not Advantage plans. These are supplements, and they are different animals than Advantage plans. Yes, they do. Premiums do increase every year with supplements, with Medicare, with car insurance, home insurance, life insurance. That's why insurance has us by the throat, kind of.
Even with the Advantage plans?
Advantage plans can have increases or changes in costs, and we're going to talk about them next. Sure. Any other questions about the supplements? This handout that the Division of Insurance puts together takes a long time to put together. And it says August 2019, but this is the most current document. We won't get another one from them until summer of 2020. So again, because this information is not designed to be exact premium quotes or information, it's designed to get you in the ballpark of the companies or weed out the companies that you wouldn't want to get more information from. It's a good tool to have, and it's a good bit of information to have that gives you all of the companies that might be available to purchase coverage from. And it's nice to know what plans each company may sell. So it's a good tool to help narrow down the companies that you would even consider contacting for more information or specific price quotes. Now, for those of you who are turning 65 anytime soon, I'm sure you're not being inundated at all with junk mail. If any of that junk mail is from a company that sells supplements and you open it and it has anything that looks like this chart, there may be an exact price quote in that mail that would be applicable. That would be what you pay this year if you choose to purchase a supplement with that company. And it should have one of these charts in it. It's required that they have it so that you know what the plans are that they are trying to sell you and giving you price quotes on. And sometimes they have actual applications in them that you can fill out and mail in. So that would be one way to get exact price quotes with any of these companies for any of these plans, is if you have that junk mail. Otherwise, you can call them. Some people are more comfortable using a broker or an agent. I'm sure if you call the 800 number, they'll be happy to hook you up with a broker or an agent. There's no change in your costs if you use an agent versus just calling them directly via the toll-free number.
Enrollments like that. You get it like every 2 or 3 months, the funeral expenses, but they make it look like a W-2.
Yes, so they've gotten very good at making junk mail look much more important than it is. Yeah, junk mail is junk mail, and you've got to be careful what you pay attention to. And there's always supposed to be somewhere on there that in itty bitty teeny tiny print it says this is not affiliated with or something like that. But yeah, unfortunately, there's nothing I can do to stop the junk mail. Yes. Would it be better to go with a Medicare Advantage plan versus a supplement? That is a loaded question. That is the reason you are here, is so that I can help you decide if that is a good idea for you. That may be what you find is the case, but well, so let's talk about Medicare Advantage plans if there's no other questions about the supplements. So Medicare Advantage plans are going to be your other option when you are just becoming eligible for Medicare A and B. Medicare Advantage plans are very, very different than Medicare supplements. Extremely different, 2 entirely different kinds of animals. Medicare Advantage plans are private insurance companies that contract directly with Medicare. Because they contract with Medicare to act as Medicare on Medicare's behalf, they're sometimes referred to as replacement plans. When you enroll in a Medicare Advantage plan, that plan becomes your Medicare. Medicare pays that plan to act on their behalf. You still are given all your rights and protections of original Medicare. They still have to follow all the rules and regulations, state and federal, of original Medicare, and provide you any and all services that original Medicare would provide. But they're called Advantage plans for a reason, and there could be some advantages in free gym memberships, dental and vision benefits, albeit probably limited at no extra cost, hearing services or hearing aid reimbursement or assistance. Most Advantage plans will come with drug coverage at no extra cost. Medicare and a Medicare supplement, you have to buy drug coverage in addition to those. Medicare Advantage plans come with the drug coverage, usually. Not always, but usually, at no extra cost. But there's pros and cons to everything. Medicare Advantage plans have a few more limitations. You have to live in the plan's service area in order to enroll in it. For all intents and purposes, a plan's service area is going to be your county of residence. So whatever county you live in, you have to buy a plan that's available in that county, and typically it's only going to be good primarily in that county for services. If you're traveling and you have a medical emergency or urgent need, that plan will pay for that medical emergency or urgent need anywhere in the country. Yes. You must have A and B of Medicare to have an Advantage plan. And if you are diagnosed already with ESRD or end-stage renal disease, you cannot buy a Medicare Advantage plan, and that is for your protection. But Advantage plans are a little more accessible. You can enroll in a Medicare Advantage plan surrounding your initial enrollment into Medicare A and B. That 7-month window. But Advantage plans have a few more opportunities to make plan changes every year. There's the annual enrollment period or election period, what we call open enrollment around here. That is the enrollment period that has been around for the longest. It's for Part D and Advantage plans. It's October 15th through December 7th every year, where you can get into or out of an Advantage plan or Part D plan, or switch from one plan to another for Advantage and Part D without restriction during the annual open enrollment period. And then Medicare last year decided to implement a new enrollment period specifically for people in Advantage plans. That enrollment period is January 1st through March 31st each year. It's only usable for people who are enrolled in an Advantage plan as of January 1st that year. And if you have an Advantage plan on January 1st, you can use any of the next 3 months to switch to a different Advantage plan or get out of Advantage plan altogether. But you have to be in an Advantage plan to do anything during that time frame. And then, of course, as with all things Medicare, there are special opportunities to make changes based on basically involuntary loss of other coverage. Again, the annual enrollment period or open enrollment applies to both Medicare Advantage plans and Part D standalone drug plans. You can get into or out of those kinds of plans or switch from one plan to another during that time frame. Any change you make between October 15th and December 7th goes into effect January 1st. The new Advantage plan open enrollment period, you must be in an Advantage plan come January 1st to do anything during this enrollment period. And it only allows you to switch from one Advantage plan to another or get out of Advantage plans altogether. If you get out of an Advantage plan, that does not mean you'll have guarantee into a supplement though. Because if you're not in your initial enrollment or guarantee windows, this is not involuntary loss of coverage, it's choice. Special enrollment periods, again, are going to be surrounding involuntary loss of coverage of some sort. Medicare, several years ago, when Advantage plans basically exploded onto the market, which was pretty much right around the same time Medicare Part D came into being. Many people may not realize that Medicare did not cover drug benefits prior to 2006. All drug costs were out of pocket. Medicare did not have a drug benefit. In 2006, Medicare implemented Part D, or a drug benefit for you. That is about the same time Medicare Advantage plans suddenly became very, very popular or very numerous, and they exploded onto the market. Unfortunately, there were many insurance agents out there that were selling these plans without clearly explaining what these plans were, how they worked. And so people were enrolling in this kind of coverage, not really understanding what they were enrolling in or how it worked. Because of that, and because it created a lot of issues, Medicare had to create a rule. That's what always happens, is there's enough complaints, Medicare makes a rule. And that rule said that you are now going to be given a test drive opportunity for Advantage plans. The test drive opportunity you can use in two ways. When your Medicare A and B first go into effect, you can enroll in an Advantage plan initially and have up to 12 months to test it out to see if it's going to be good coverage or the kind of coverage that works for you for the long run. If at any point within that 12-month window, you decide that that is not the coverage you want for the long haul, you can get out of that Advantage plan and still have guarantee issue into a supplement. This test window, if you try Advantage plans first, you have to enroll during your initial enrollment window, that's of getting Medicare A and B. And you have to disenroll from the Advantage plan if you choose not to want it within 12 months. So you can let it go all the way 11 months and 2 weeks or 3 weeks. But if you go 365 days, your test drive has expired. So you gotta be careful about the timing. It coincides with your initial 6 months of guarantee issue into a supplement if you do this first. Because again, once A and B go into effect, that 6-month window of guarantee issue into a supplement clock starts ticking and cannot be stopped. So this would coincide with that guarantee issue window, but it may extend that guarantee issue for almost another 6 months. If you choose to disenroll from the Advantage plan during the second 6 months of that year, you are going to be more limited to what plans you would have to choose from in guarantee issue into a supplement, but you would still have guarantee issue in a 63-day window in that second 6 months. If you choose to disenroll from the Advantage plan within the first 6 months, again, you're still in your initial 6-month window and you can do whatever you want because you're in that 6 months. The other way you can use a test drive is if you enroll in a supplement initially and you have continuous coverage through that supplement, and 3, 4, 5 years down the road from now, you decide you really, really want to know what Advantage plans are all about, because all your friends are making fun of you because they have them and they don't pay any premium, and you're paying a premium for your supplement. As long as you've had continuous supplement coverage from day one, you can disenroll from that supplement, enroll in an Advantage plan during an annual enrollment period, and get 12 months to test drive it. And if you decide within that 12 months that you want back into your supplement, you're guaranteed back into your supplement. If your supplement plan no longer exists, you're guaranteed back into any other company's supplement plan, the next best level. So it gives you 2 opportunities or 2 different ways to test drive Advantage plans to see if that's going to be adequate coverage for you, if it's going to be workable for you. And you can use those test drives, but once you've used it, that's all you get, whether you use it initially or down the road. And unfortunately, if you're under 65, you don't get one. You don't get a test drive. I don't know, I'm not quite sure why, but they don't extend that test drive opportunity to people with Medicare under 65. Another way that you might be able to get guarantee into a supplement, because you have to buy an Advantage plan in your service area or county of residence. If you move from El Paso County, for example, to Toler County, you cannot take your Advantage plan with you to Toler County because it is an El Paso County plan. So when you make a change of address, you have an opportunity to buy a plan that's available in the county that you move to, whether it's in Colorado or another state altogether, or because you can't take it with you, it's considered involuntary loss of coverage. It's not your fault. It would provide you an opportunity to be guaranteed into a supplement. But you got to keep in mind, they don't go where you go. If you make a change of address, you have to find another plan in the area that you move to. You still have to pay your Part B premium. There's no getting out of that. Many people think there is. Many people think that premium goes to the Advantage plan or is paid by the Advantage plan. Many Advantage plans, especially in this area, have no monthly premium. As long as you're paying your Part B premium, no additional premium for the insurance. Very attractive. But in exchange for that, you may have other out-of-pocket costs. Again, you get all the Medicare covered services that original A and B would provide. Most of them will include Part D at no extra cost, but you may be limited to who you can see and where you can go for services. Although, like I mentioned before, emergency or urgent care needs are paid for no matter where you're at in the country. And certainly the cost sharing and benefit structure is slightly different than original Medicare with a supplement. There are many, many different kinds of Medicare Advantage plans. There are HMOs, PPOs, fee-for-service, special needs. We still have cost plans, but they're sunsetting, so we won't talk about those much. All of those plans and the availability within the state of Colorado are listed in the Medicare You handbook if you get a Colorado-specific Medicare You handbook. And you can call 1-800-MEDICARE and ask them to mail you a Colorado-specific handbook. Otherwise, it'll be a general handbook that will not list the plans available in specific states. But because these plan choices are limited by your area, if you want to know what plans are available in Colorado, you want to ask for a specific Colorado book. Or you can always call 1-800-MEDICARE and ask, or you can go to medicare.gov, and they have a search engine that will help you find the plans available in your area.
So basically, the Advantage plan is an agreement between the insurance company and the federal government. So the government's actually paying the insurance company.
So Medicare Advantage plans are private insurers that contract directly with Medicare to act as Medicare on Medicare's behalf. So Medicare pays them to provide you the Medicare benefits for Medicare.
So that's why there's no
That could be potentially one of the reasons, yes. Yep. So there are additional types of plans, Medicare savings accounts, although there are none in existence yet. No company has stepped up to provide that. Cost plans, demonstration and pilot programs we don't have currently in the state, but we do have a PACE program. We're going to talk about all of these in a little bit. We're going to touch on all of them real quick. How many people have ever been in an HMO? Just a handful? HMOs are HMOs. Most Advantage plans in Colorado are HMOs. And an HMO is an HMO. And if you've ever been in one, you know what that means. They all work the same way. You're required to have a primary care provider. You're required to stay in network. You're not allowed to go out of network. Referrals may be required for specialists. Pre-authorizations may be required for some services. All Medicare Advantage plans that are HMOs include Part D drug coverage. Emergency care is covered anywhere. But you have to stay in your service area. You cannot go out of network. PPOs are similar. Preferred provider networks have a network of providers and facilities that they contract with and they would prefer that you use. And as long as you use their network of preferred providers, you will pay lower copay, but you're not limited to that network. You are allowed to go out of network as long as you can find a provider who is willing to take the plan's payment and your copayment as payment in full. Because you're allowed to go out of network, referrals are no longer required with PPOs, but there may still be prior authorization requirements for some services. You go out of network, you're going to pay a higher copay than if you'd stayed in network. PPOs may or may not come with Part D coverage included. If it comes without Part D coverage included, you cannot buy Part D separately. So you have to have a reason you don't need drug coverage through your Medicare, such as you access the VA, for example. Fee-for-service plans were designed not to have any networks. They were supposed to give you the freedom to go and see any provider that you wanted anywhere in the country. Unfortunately, these are Advantage plans. You have to buy a plan available in the county you reside in the hopes that there's providers in that county that will take this plan. Many agents were selling these plans to people in counties where no doctors would take them. So Medicare had to make a rule that now requires that fee-for-service plans contract at least one provider in every county that they're sold in. Otherwise, you're able to go to any provider anywhere that is willing to take the plan's payment and your copayment as payment in full for services. However, because there's no contract with these kinds of plans, the provider can agree to take you as a patient one day, but decide not to take you the next day. They're not required because there's no contract. These plans may or may not include a drug benefit. If they do not include a drug benefit, you would be allowed to buy a separate drug benefit to go with that. Special needs plans are basically Advantage plans that are HMOs, but they're for very specific populations. People who are either Medicare and full Medicaid, are residing in long-term care facilities, or have qualifying chronic health conditions. If anybody's interested in more information about the Medicare special needs plans, you're welcome to come talk to us afterwards. They're basically HMOs for specific populations. Cost plans, I'm not really going to talk about too much because they are being sunset in Colorado because they're not competitive enough in the areas that they're available in. PACE program we do have in this area. Stands for Program of All-Inclusive Care for the Elderly. PACE programs are basically an HMO on steroids, but for very specific population of people who are Medicare and full Medicaid long-term care. And that program is designed to help keep people at home for as long as possible, keep them out of a long-term care facility by providing more maintenance, more care. So they get very, very involved in someone's everyday management of everyday activities. They make sure you get medication management, socialization, transportation to medical appointments, whatever they need to do to keep you in the community and out of a nursing home for as long as possible. In Advantage plans, again, you get all the rights and protections that you have in original Medicare. Most of this, I would hope, shouldn't have to be said out loud, but obviously it does. You have a right to access healthcare providers, to know how your doctors are paid, to fast and efficient appeals processes, to fast appeals in certain health settings, to be able to get the healthcare that you need, to have your private personal information protected, easy to understand information. Honestly, I would think that would all be assumed to happen, but obviously it's not. If this is the kind of coverage you are interested in looking at, there are a couple of questions I would suggest you ask yourself before you sign on the dotted line. Primarily, if the plan covers prescriptions, you want to make sure it covers your prescriptions. There are 50 plus Advantage plans of any kind in Colorado this year, which is twice as many as were available last year. Each one of those 52 plans, if any of them include a drug benefit, they include a different drug benefit than the plan next to them. So every plan that includes a Part D benefit has a slightly different benefit than the next guy. Every standalone drug plan that is offered in Colorado, and there are 26 of them for standalone drug coverage, has a slightly different drug benefit than the next one. So it's very, very important that your specific medications are covered by whatever plan you're considering. If you have a primary doctor or any medical doctor that you do not want to lose or change, you would want to ask that provider first if they take whatever plan you're looking at, or if they take any Advantage plans at all. Otherwise, if you enroll in that plan and they do not accept or are contracted with that plan, you cannot see that doctor anymore. In this area, we have 2 hospital networks. Some people have very, very strong opinions about one network over the other. I know from personal experience, my grandmother had very strong opinions about one hospital over our other hospital. If that is the case, you might want to make sure which network a particular plan contracts with, because some will only contract with one or the other. If you doctor a lot or see a lot of specialists, HMOs specifically, or primarily, and PPOs in some cases, may require that you get a referral from your primary doctor before you see any specialist each and every time. So now you're looking at a copay for the primary doctor potentially, and a copay for the specialist every time you need to see a specialist. That may become costly. So that might be something you take into consideration. Anything else that you think is relevant to your specific situation? Those are the questions you need to ask yourself and the plan before you enroll in it. Because of the limitations to these plans, you want to make sure that it's going to suit your needs and your requirements before you get into it. Any questions about any of that? So does that help answer your question about what's more cost effective, or which one is better, or is one better than the other? Probably not. But you hopefully understand it a little bit better and can kind of compare those things and weigh those things yourselves. Yes.
Your department is SHIP, is that your department? Or you're the Department of Aging?
So this is the Area Agency on Aging, and I am employed by them as a SHIP counselor, which is a state program.
So the SHIP counseling, you can make appointments to have. And
Correct.
where's that office?
So SHIP counseling for through the Area Agency on Aging is located here. We are employees of the Area Agency on Aging, contracted with the state to provide the SHIP service. Walk-ins are always welcome here, Monday through Friday. This building,
Okay.
yeah. Walk-ins are welcome Monday through Friday between 9 and 4. We are happy to schedule appointments, or we can answer the phone, you can shoot us an email, however you would like. We're happy to do that.
Specific situation, like if you are working,
Hmm?
you want to decide whether to take like Medicare Medicare.
Everybody's situation is different, yeah.
That's why it would be advantageous.
And that's one of the best benefits of SHIP counseling is that you have the ability to sit down one-on-one with a counselor to go over your situation and help you figure out what your best direction is going to be.
That's great,
Yeah.
thank you.
We are running a little bit behind. So we still have Part D to cover. We may go through that fairly quickly. I don't want to keep you here much longer. Any other last questions about Advantage plans or supplements before I move on? Okay. There is financial assistance available for people who have limited or low incomes to help cover the costs of Medicare, primarily the Medicare Part B premium. They're called Medicare Savings Programs. These are federally funded programs, but you apply for them through the local Medicaid office. Eligibility is based on income and asset limits. These are the limits currently to qualify. These are gross dollar limits, pre-deduction dollars. If anybody wants more information about these programs, we are happy to provide that information after the presentation or at another time. We help with these applications. We can help determine eligibility for this and other financial assistance programs. So if anybody wants more information, just contact us. Last thing we need to talk about is drug coverage or Medicare Part D, D for drugs. Again, Medicare Part D came into being in 2006. Prior to that, Medicare did not cover prescription drugs at all. Medicare Part D, as with any part of Medicare, is optional. And there are many different levels or different plans to choose from. In order to be eligible to get a Part D, you only have to have A or B of Medicare or both. Whereas with supplements or Advantage plans, you have to have A and B. You can have Part D if you only have A or B or both. Again, plans vary. The coverage that they provide vary from plan to plan. The differences are going to be in what drugs are covered, what the costs are, what the co-pays are, what the tiers are, what the deductibles are, what the premiums are. All those vary from plan to plan. And again, there are 26 Part D standalone drug plans to choose from in Colorado this year. And there are over 50 Advantage plans to choose from in Colorado this year. There is also financial help available to help with the cost of just Part D for people with limited or low incomes. We'll touch on that the last slide. Do you have to enroll in a Part D? No. Just like any other part, it is optional. I get a lot of people asking me, why should I enroll in a drug plan if I don't take any drugs? Which is a valid question. My answer is, why should you enroll in healthcare if you don't go to the doctor? We enroll in insurance not because we are going to use it or want to use it. It's because we may need it or just in case in the future. And again, that's why insurance has us all by the throat. In many cases, we're required by law to have insurance. Insurance is part of life. You don't have to enroll in Part D, but why wouldn't you? In case you need it in the future. If you have other coverage, though, other credible coverage, such as you are VA and you access the VA pharmacy, that VA pharmacy is considered credible enough not to have to enroll in a drug plan. It's considered as good as or better than Medicare's drug coverage. If you have drug benefit available through retirement benefits, TRICARE or PARA or federal or even private employer, that drug coverage, the employer is required to tell you every year whether or not their drug coverage is considered as good or better than what Medicare drug coverage offers. And if it's considered as good or better, then you don't need to enroll in a Part D. If you don't have other credible drug coverage and you choose not to enroll in a Part D because you don't take any drugs, you would be allowed to enroll any given year down the road during the annual enrollment period, open enrollment, and get into whatever you wanted to be effective for January of the next year. But because you didn't have other credible coverage in the meantime, you will pay more for Part D down the road when you enroll. Same enrollment periods as enrolling in Medicare, your initial 7-month window surrounding your 65th birthday. Again, Part D and Advantage plans get the annual open enrollment period, October 15th through December 7th. Changes go into effect January 1st. And then special enrollment periods based on loss of other credible coverage. Penalties for not enrolling in Part D and not having other credible coverage. 1% per month for every month you did not have other credible coverage. And it will accumulate over time. So if you do not enroll in a Part D when you turn 65 because you don't take any drugs, you don't have any other credible coverage, 3 years from now, the doctor puts you on a heart medicine, and now you decide you want Part D, you can enroll in Part D during open enrollment, but you will be penalized potentially 36% for the 36 months you did not have drug coverage. That 36% would be multiplied by whatever the monthly national average premium is for Part D plans across the country. This year it's $32.74. Whatever that amount comes to, when you multiply the 36% by the $32, whatever that comes out to will be tacked on top of the monthly premium of the Part D plan that you choose to enroll in that year. The purpose behind penalizing you for not enrolling when you were initially eligible is to discourage you from waiting until you have a high expense before you enroll. Because Medicare will allow you to enroll, so you're healthy, you don't take any drugs, and then boom, suddenly doctor puts you on a $1,500 a month drug. You can enroll in Part D now and get that drug covered at a copay. But if everybody did that, just like any other kind of insurance we have, yep. And that's the way they want you to think about Medicare coverage, is like any other insurance we have. We buy it not because we want to use it or intend to use it, but just in case. The worst part about the Part D penalty, though, is it will always be that 36% in this example, but the amount of penalty will change based on the national Part D average monthly premium across the country from year to year. So last year, that national average Part D premium was $33 and change. This year, it's $32 and change. Every year when that amount changes, so will the amount of penalty that is tacked on top of your premium, times 32% or 36%. It just ends up being a lot of math. I can't even spit out of my mouth right now. And penalties are forever. They never go away. It's not a one-time deal. It's not a one-year deal. It is tacked on top of your monthly premium for whatever you purchase from year to year forever. So 36% of $32 is not a huge amount of money, but you multiply that times 12 months for the rest of your life, it can add up. I mentioned earlier that there's a penalty for Part B. If you don't enroll in Part B at initial eligibility and you wait till the general enrollment period for Part B, the penalty for Part B is 10% per year for every year you don't enroll, multiplied by whatever the premium is in the year you do enroll, and tacked on top of your monthly premium forever. So penalties never go away if you're assessed a penalty, period. And it can add up. Unless you become low or limited income and qualify for assistance with those costs. So what do you get for all that? Medicare Part D has a basic outline of coverage. This is the basic outline of coverage. This is the minimal level of coverage any Part D benefit can be provided to you through any means, whether it's a standalone drug plan or through an Advantage plan. This is the least amount of coverage that you can get. That outline of coverage says that there is an annual deductible. This year, that deductible is $435. What that means is when you enroll in a plan and you go to the pharmacy for the first time after you've enrolled in that plan, if your plan has a deductible, you're going to pay full retail cost for your medication when you go to the pharmacy until you spend $435. Once you've spent $435 in retail costs, the next time you go to the pharmacy, you should pay a much lower cost in the form of a copay. Worst case scenario, that copay is going to represent 25% of the retail cost of that medication. While you are paying full cost during deductible and then paying 25% of the cost of retail after deductible, What Medicare and your drug plan are doing is they're taking the full cost of everything you purchase and adding it up in a column over here. If over the course of the calendar year, the numbers in this column of the full retail cost add up to $4,020, you will have hit what they used to call the donut hole, or it's called the donut hole. In the past, if you hit the donut hole based on retail cost of your drugs, when Part D first started, you went back to paying full retail cost and still had to pay your premium for Part D coverage. As time has gone on, the amount that you pay went from 100% of retail in the donut hole and gradually reduced every year until it hit 25%. The most anybody will pay when they hit that $4,000 mark is 25% of retail in the donut hole. Medicare considers that the donut hole being closed because your costs will never go above 25% after deductible anymore. Once you hit the donut hole, if there's still time left in the calendar year, you're still going to the pharmacy and paying copays to pick up your medications, they're still adding up what you're spending over here in this column. The downside is now they're only adding up the 25% you're paying instead of the full retail cost. If somehow you manage in 25% to hit a total of $9,000 before the end of the calendar year, you would have reached the other side of the donut hole. And at that point, the cost at the pharmacy would go to 5% of retail or less, or $3.60 generic, $8.95 brand name or less, until the end of the calendar year. And then come January, it starts all over. Now, that used to be a much more horrific story when the cost that you paid in the donut hole was much higher. These days, most Part D plans do better than this. This is worst case scenario. And I don't know any plan off the top of my head that does this. Most of them do better. But this is the minimum benefit that is going to be provided to you through drug coverage. When I say most of them do better, what I mean is many plans for drug coverage, whether it's through your Advantage plan or standalone Part D, may pay your deductible as part of the coverage. It may provide zero copay preferred generics or dollar copay preferred generics. It may provide same copay level in the donut hole as you paid before the donut hole. So most of the plans are going to do better than 25%. The difference would be when you hit that donut hole, if you're paying a zero copay generic and you hit the donut hole, you're going to start paying 25% of retail instead of zero copay. And that's where people may see the difference in costs. Or if you're paying a $40 copay for a $500 brand name drug and you hit that donut hole, 25% of that $500 brand name drug may be lower than the copay you were paying. So there could be pros and cons to hitting that donut hole now that it is considered closed and maxes out at 25%. Medicare requires all Part D benefits cover at least 2 medications in every class of medication, every medical class. However, if there are 20 different drugs available in a specific class, the plan only has to cover 2, which is why it's all the more important you make sure that your drugs are one of those if you get that plan. Just because they cover a class of drugs doesn't mean they cover what you take. There are 6 classes of drugs that all plans are required to cover anything available in those classes. Honestly, if it wasn't such a long day, I'd try and pronounce these, but I'm not going to try and pronounce these today. But they have to cover anything that's become available for treatment in those 6 classes. They have to cover all of them. However, they're probably going to be tiered at a very high level because they're considered specialty drugs and they're going to be very expensive. Medicare Part D requires that if it's covered through a Part D benefit, it has to be prescribed by a physician, has to be approved by the FDA, and it has to be approved for its medically intended purpose or used and prescribed for its medically intended purpose. What does that mean? That means if the doctor is prescribing Viagra for high blood pressure, doesn't mean Medicare is going to pay for it because that's not what Viagra was created for or its initial intended purpose. All plans have to cover drugs, biologicals, including insulin and the supplies for injecting insulin. And all plans have to cover brand name and generic drugs. However, I can guarantee you if you are on a brand name drug and it goes generic halfway through the year, the plan is only going to cover generic after that. So keep that in mind. Things not covered by Part D, anything that would be covered already under a Part A or Part B benefit. So if you received medications while you were inpatient in the hospital, that's covered under the hospital benefit Part A. If you are getting infusions in a doctor's office or chemo treatments in a medical setting, those are Part B medical services, not drugs. Medicare Part D covers prescriptions that you get a script from the doctor and take it to the pharmacy and pick up the medications from the pharmacy. That is Part D. Does not cover anything considered over the counter. Does not treat medications if they are specifically and solely to treat anorexia, for fertility purposes, or for cosmetic purposes. And even if it requires a doctor's prescription, if it's solely to treat cough and cold symptoms, Medicare will not pay for it. Robitussin is a perfect example. Most vitamins and minerals are not going to be covered unless they're prescribed for a specific chronic illness or disease. That's Part D in a nutshell. Now, there are a lot of plans out there to choose from, and I've already mentioned several times that each one of those plans has different drugs to choose from, different drugs that they will cover. It is almost impossible to determine what drug plan is going to give you the best coverage for your needs, unless you go online. Medicare created a search engine, basically, that allows you to put in all your specific medications, dosages, quantities. You can even tell it what pharmacies you prefer to use, and it will take that information, compare it to all the drug benefits available in the state of Colorado, and the end result will be those plans are sorted from the plan at the top of the list that would be the most cost effective and give you the best coverage for everything you need, to the bottom of the list would be the plan that would cost you the most money with the least coverage for your needs. So it basically does all the work for you, and it sorts them in the most cost effective to the least cost effective. That is really going to be the most effective way to determine what plans cover your prescription needs. That is something anybody can use. It's on the Medicare.gov website, and it's called the Plan Finder. During open enrollment, that's all we do here. We saw over 800 people between October 15th and December 7th last year for help specifically with that tool. And we're happy to do it for anybody. We're happy to help walk you through it. We're happy to show you how to use it. We're happy to answer questions if you tried and ran into issues. Or we're happy to just help you do it and go over those results and help you interpret them if you would like us to. But that is going to be your best tool to determine what plans are going to cover your needs.
And with Part D, you can change every year. Your Medicare,
Part D and Advantage plans, annual open enrollment, you can change without restriction. These plans do not care what you take. They're not going to care if you have a $1,500 medication, because these plans have already told Medicare months ago what they'll pay for. So it's not a matter of, will they cover me? It's a matter of you finding a plan that has already said this is what we'll cover. So it's without restriction that you can make changes every year. There are still patient assistance programs available for people who are on the more expensive brand name drugs. Basically, if you still see a commercial on TV for it, it's really expensive. All of those new diabetic medications, I mean, if there's a commercial, you're talking $500 or more a month in cost. Because of that, even Part D coverage may not make it cost effective for you. Or you may hit the donut hole, and 25% of $1,500 is still a lot of money. Because of that, Medicare, or most of the manufacturers of those drugs, still have patient assistance that they will provide to people with Medicare drug coverage, depending on the drug, but it's usually only going to be applicable to the brand name medications. Patient assistance programs through the manufacturer are usually pretty generous in their income and asset limits. So more people may qualify for that than any other kind of assistance. The websites that we've listed are just a few of the websites that are available to help find that information. These are the ones we tend to use more often than not. Some of these websites, you can not only get the criteria for eligibility, you can download the applications, which I think is very handy in those situations. And we're always happy to help with that search as well. Again, there is help available for people on limited or low incomes just for Part D costs. That assistance you apply for directly through Social Security. The income and asset limits are higher than for the other program I mentioned earlier, the Medicare Savings Program. So more people should qualify for help with drug costs than qualify for help with the medical Part B costs. Again, we help with these applications and are happy to talk to anybody about these programs at any time. We're done. Resources, the Medicare You Handbook obviously is going to be your best resource. The website is more comprehensive, or again, you can call 1-800-MEDICARE. They're available 24 hours a day, 7 days a week, all year long. And at 2 o'clock in the morning, when you get up to get that drink of water, they are dying to talk to somebody. Get right through. Otherwise, you're always welcome to come to your local SHIP office. That's what we are here for. And again, walk-ins are welcome 9 to 5 or 9 to 4, Monday through Friday. You can call or email for a scheduled appointment. We do these classes at least 3 times a month right now. This is a federal program. Every county and every state should have access to a SHIP counselor via a toll-free number at minimum. Our office also does the fraud prevention program, Medicare, the Senior Medicare Patrol, or the fraud program for Medicare that helps detect and report fraud with Medicare and Medicaid, or if there's any billing concerns or issues. And we are always looking for volunteers. It is actually one of the funner things that you can do with Medicare is get people in trouble when they're not doing it right. And secret shopping is really fun. That was my favorite part, but I can't do anymore because now they recognize me. But we're always looking for volunteers, and just give us a call and we'd be happy to talk to you about that as well. This was a recorded live webinar presentation, and a recording of this presentation should be available on any of our social media sites within a week. If you have any questions and you're not able to get us on the phone, you are always welcome to shoot me an email. That senior insurance comes to me directly, and I'm usually able to get back to you within 24 hours. Now we're officially done. Any other questions? No? Okay.
Thank you.
You're welcome. Thank you for hanging in there. In your packet, there was a survey. We do appreciate if you